This panel is a conversation about the fight to save Interfaith Medical Center in Bedford-Stuyvesant's neighborhood in Brooklyn, New York. These events inspired the publication of our interactive case study of that fight, building a culture of health in central Brooklyn, from protest to health systems of transformation. In addition to this conversation, this panel is a celebration. It's a celebration of individual leaders and the fighting spirit that galvanized the coalition. It's a celebration of having saved a hospital. It's a celebration of what success catalyzed. For example, the plan for the Brooklyn Health Enterprise Hub, which we'll hear more about later. And it's a celebration of the history and relationships that drive this effort to this day. This panel is also a celebration of ingenuity. Long before the pandemic, this group, catalyzed by the fight to save Interfaith, was fighting for precisely the things that would have saved so many lives this year: reliable healthcare, steady income, essential services, healthy housing, local supply chains, wealth, and racial equity. And as you will see today, it is this group that fought to save Interfaith, and that just keeps going. So today, it is my privilege to introduce you to some of the leaders of this group who have graciously taken their time to be part of the panel and to represent their colleagues and partners. We are joined today by Attorney General Letitia James, by George Gresham, President of 1199 SEIU, United Healthcare Workers East, and panelists, LaRay Brown, CEO of One Brooklyn Health System and Interfaith Medical Center, Dr. Torian Esterling, First Deputy Commissioner and Chief Equity Officer for the New York City Department of Health and Mental Hygiene, Roger Green, co-chair of the Coalition to Transform Interfaith and Director for Public Policy of CUNY Law Community Economic Development Clinic, Michelle Ned, an employee at Interfaith Medical Center and the co-chair of the Brooklyn Worker Council, Sharani Perry, the Director of Community Relations for Interfaith Medical Center, Bruce Richard, Senior Consultant to 1199 SEIU President of Community Health. And on behalf of David Cohen, Executive Vice President for the Population Health and Academic Affairs at Maimonides Medical Center, Ms. Shari Sukoff is with us. Shari is the Vice President for Policy and Strategies at Maimonides Medical Center. And as part of today's celebration, we are honored to be joined by Attorney General Letitia James to get us started. A.G. James was a key leader in the interfaith fight, born in Brooklyn, going on to represent Brooklyn, including Bed-Stuy, where Interfaith Medical Center is located, as a New York City Council member, then representing all 5 boroughs of New York City as public advocate, and now fighting for all New York State New Yorkers as Attorney General. We invited A.G. James to be a part of The Future Grows in Brooklyn because not only was she part of the fight to save Interfaith, but because she understands so well the implications of that fight for life and death in Brooklyn and in the neighborhoods that we care so much about. We also invited A.G. James because she herself embodies her journey and is emblematic of the case study's most critical lesson. We need all leaders and the help and support of everyone who joined us today, that are deeply rooted in their communities and who have cultivated the vision and power to make the kind of structural changes that are needed for our communities, and to give them the tools and the room to grow and thrive. So thank you again, A.G. James, for being with us today. And I now turn the conversation over to you for opening remarks and some welcome words.
Good morning, everyone. Good morning to all of my colleagues and to all of my friends in this struggle. And thank you, Dana, for that very kind and gracious introduction. And thank all of you, the Interfaith Coalition, for the invitation to join you for this virtual town hall meeting. I first want to take a moment because when we were watching the video, the introduction, there were so many individuals who have transitioned, who have gone on to glory, and I miss all of them. And so if you don't mind, because we are a community of faith, it's important that we recognize all of those who joined with us in this fight, who are now, have gone on, and who are now looking down on us, smiling. So let's just take a moment to think about all of our friends who are with us and who are still within our hearts. Thank you. I want to start by congratulating the Coalition on the recent publication of a case study documenting the growth and achievements. Since my time as City Council member and as public advocate, now as the Attorney General, I've been a steady supporter of the Coalition's goals. They've been supportive of all of my efforts, and I've stood by them. But more importantly than that, as someone who lives not too far from Interfaith, I recognize the importance of having a institution which is part of the family, where when you walk in the door, everyone knows your name. It's been an honor to work alongside such dedicated advocates and change makers to save Interfaith Hospital. It was a long journey, but we did it. And today they've grown from a coalition focused on one hospital to a much broader alliance with much bigger goals of basically reforming and transforming healthcare access in Brooklyn. Because we do know that in Brooklyn, we lead in just about every category. All of the indicators, health indicators, unfortunately, in central Brooklyn are pretty troubling. But Interfaith obviously continues to serve our healthcare needs. There's never been a more important time in the fight for quality and affordable health coverage in the United States than now. We are in the midst of a global pandemic, and yet a number of state and federal officials seem committed to changing Americans' exorbitant prices for pre-existing conditions, or worse, basically denying them coverage altogether. And we all know about the racial impact and the disparities that unfortunately have affected central Brooklyn as a result of this pandemic. And we all know that we are facing a wide range of pandemics, including COVID-19, but also structural racism, unemployment, and the like. And so it's important that we need access to universal health care, because universal health care access is a right, not a privilege. And that's why my office has continued to fight back against this administration's attempts to gut and chip away at the Affordable Care Act. And that is why this hearing this morning with regards to the appointment to the Supreme Court by Judge Barrett is so critically important, because of all of her writings relative to attacking the Affordable Care Act. But this coalition, we have led a number of efforts blocking. We've led a number of coalitions all across this nation, blocking states from imposing unconstitutional restrictions on women's reproductive care. And this wonderful hospital and this wonderful coalition has supported a woman's right to choose. And we will continue to keep the doors open for that, for individuals to exercise control over their own bodies. And at the height of the pandemic, my office, again, worked with this wonderful coalition. We donated gloves and masks to healthcare professionals, and we urged state leaders to take further action to expand COVID treatment and to increase hospital capacity. But truly recovering from the pandemic requires more than just a dedication to our healthcare system. It requires recognition of the systemic inequities that have unfortunately revealed themselves and have only been exacerbated by the healthcare crisis. We've got inequities in healthcare where data reveals that the virus has had a disproportionate impact on communities of color, as I indicated earlier. Inequities in the labor force, where most of the individuals laid off are women, and particularly women of color. We must focus on the short-term healthcare needs of our communities, as well as the long-term goal of tackling inequality head-on. And this can be done at the local level. And it's important that, again, we continue to do it here in Central Brooklyn. Let me leave you with basically a call to action. And first, this is an election year, and we have an opportunity and an obligation to vote for change in November. We literally have 19 more days, and the officials we elect to office make decisions that have a profound impact on our lives and on resource distribution. And we must not miss the chance and the opportunity to choose wisely. I do know that when the pandemic hit this state, it was this coalition, as well as elected officials in Central Brooklyn, who demanded that we have test sites in Central Brooklyn, who demanded that we have PPE in Central Brooklyn, who demanded that we have more resources for small businesses in Central Brooklyn. It was this coalition that led the way. Second, we've got to show up for our community, show up at a community board meeting, show up at town hall meetings like this, and get involved in our children's school and get involved, obviously, in our institutions. The Interfaith Coalition is a great example of the power of like-minded neighbors and community members and friends banding together for a common cause. And when we mobilize and invest at the local level, we can effect meaningful change, as we have done here. We've marched together, we've struggled together, we've protested together, and we were successful together. Again, thank you to the Interfaith Coalition for joining in this fight towards a more just and equitable healthcare system and society. And most importantly, I want to thank 1199. It was the power of the union that stood up for working class people, not only as part of Interfaith, but all across this nation. May God bless all of you, and thank you.
Thank you so much, A.G. James, for being part of this celebration and a part of this important work from its inception. And we thank you for all that you are doing and all that your office is doing on behalf of all of us. We know you may have to jump off early, but we thank you for giving us the time today. And good luck with all of your efforts. A.G. James already started part of this introduction, but we just want to have a few words and say, this work would not be possible without the constant support and leadership of 1199. Your 80 years of fighting on the front lines for quality care, good jobs, and social justice. The energy, drive, and commitment of your members. And we are thrilled to have with us this morning George Gresham, President of 1199 SEIU, Healthcare Workers United East. I pass it over to Mr. Gresham.
I'd like to wish greetings to the Honorable Tish James, to Interfaith CEO, Ms. LaRay Brown, Deputy Commissioner, Dr. Torian Esterling, to my brother and Honorable Deputy Mayor, Phil Thompson, to my brother, Roger Green, to my brother, Bruce Richard, and of course, to Ned, who is a strong supporter and intimidator of mine. If anybody knows Ned, you know what I mean. And it's such a pleasure to be here. It seems like it was only yesterday that we were talking what was going to happen to healthcare in Brooklyn if they closed Interfaith. At that time, they had closed 3 other hospitals in Brooklyn. And when you look at both the healthcare disparities that goes on in Brooklyn and the economic challenges that would have happened had this institution closed down, you realize how urgent it was that the community come together to fight this. And I remember so many times how we sat there and strategized, because at one moment it looked like this was going to happen, that they were going to close the institution. And so we began to talk about how we were going to take over the institution, how we were going to move into the institution and refuse to move out. And at the same time, how we were going to fight and bring the public opinion, to educate the public around what was happening. I remember part of it was that it was an election year for our governor, and we wanted to put as much pressure on them as possible. And I'm proud to be one of the original funders, 1199, along with Neisner, to develop this study to look at this. We've come so far. We still have a ways to go, but I sit there and I try to imagine if that plan had gone through and they had closed Interfaith, what would this year, 2020, look like with that pandemic? It is unimaginable how many more lives would have been lost. To me, it's unimaginable how it was ever thought that that made sense to do that. We knew that Interfaith for years and years were going up and down economically, were having problems staying abreast. But as I remember saying to the governor, that's your responsibility. Your responsibility is for the health of this community. Closing Interfaith is not going to make the illnesses go away. It's going to only exacerbate it. And I remember some of those very hot meetings that we had in the churches, sweltering with all of the strong community support on what we were going to do. And it was time for us to act up because there was no other solution that were being involved with us. And I'm thank God for MIT CoLab to design a white paper for us that I remember giving to the governor and said, you need to look at this before you act any further, because this community is not going to be quiet. And if we have to, we will lead that. And so to all of the 1199 members and healthcare providers that now work at Interfaith, thank you so much for the early days when you were willing to sacrifice. And what was a movement had turned into a real system of care. And we appreciate it. We know that you have a long way to go. I know to Miss LaRay Brown that the task in front of you is not easy, but thank God you're here. And thank God that we can work together as a coalition to continue good quality health care in Brooklyn. It's been a pleasure and an honor to see where we come at this point. We've come a long way. We know that we still have a long way, but now we know that we've endured the worst of this, and now it's time for us to just continue to fight to get the resources that are due our members and our institutions and our community so that quality health care can be preeminent in Brooklyn. Ironically, at the time when we're facing a real challenge to the Affordable Care Act in this country, it just seems sometimes that we're going one step forward and two steps backwards. But I know with the members at Interfaith, along with the members of 1199, that we fought for this before. Fighting is unfortunately nothing new to us, and we will continue to fight to make sure that we're saving our communities. Thank you so much for this celebration.
Mr. Gresham, thank you for your steadfast commitment and partnership to all the 1199 members who continue to show up daily in the work with us. We honor and appreciate and celebrate you on today and in this last days as we push towards the election and all the work that's before us. So thank you for joining us. And before we move forward, I just want to send regrets. Deputy Mayor for Strategic Policy Initiatives, J. Philip Thompson, and Executive Director of MIT CoLab, Dana Cunningham, are unable to join us this morning, and they send their regrets. Unfortunately, they are attending a funeral of a loved one. So we send them our prayers, and they are with us in solidarity always. So where do we begin? CoLab and our partners in Brooklyn documented the fight to save Interfaith to better understand how labor and community leaders, beginning with the four ladies in the Interfaith cafeteria, built such a broad movement for change. From activists and elected leaders to clergy, youth, artists, they rallied the whole community to save and transform Interfaith and the local healthcare delivery system. It is striving to move beyond treating illness to address the social determinants of health, and poverty being the biggest factor. And so the vision of this movement is to build community wealth, to drive community well-being, a movement that ultimately involved all corners, not because the fight was won through good fortune, but because specific and intentional leaders and interests converged to win it. From the deep relationships among healthcare workers to the long-running commitment of community activism, to dedicated leaders across institutions, to the organizing power of labor, to the state national policy environment, these are the things that we want to learn more about. We also hope that the case study serves to honor those who led and are leading the fight, to provide a tool for reflection to inform the next leg of our journey. CoLab has been part of this process and events examining the case study since 2013, beginning with the Coalition to Save Interfaith's invitation to conduct and support a community health needs and asset survey. And this is what Mr. Gresham was just speaking about that was turned over to the governor. It was generously supported by 1199 and the New York State Nursing Association, also known as NYSNA. Our involvement continued through a series of community participatory action research process conducted in 12 Brooklyn neighborhoods between 2016 and 2019, and you'll hear more about these shortly. We continue to collaborate, providing strategic coordination and technical assistance. When the idea for the case study was first presented, we understood that we would be telling the story of the fight to save Interfaith, but we also understood that we would also be telling the story of so many Black and Brown Brooklynites literally fighting for their health and their lives. We could not have imagined where we would be right now. How much the fight would intensify as it has here in 2020, in New York, in the nation, and all that we are faced with right now with an uncontained pandemic, a federal administration actively flouting public health and stoking racism, an election process thrown into question, unprecedented climate events, and all of this compounded by rampant misinformation and growing mistrust. For Brooklyn specifically, some of the worst health outcomes in the state have been compounded by some of the highest rates of COVID deaths. Brooklyn is struggling right now, but this is not a story about struggle. You may be asking, why are you talking about the future growing in Brooklyn? By the end of our panel this morning, I believe and we hope you will understand. To give our conversation some common ground, CoLab's Lawrence Hazley will bring us some more information and highlights from the case study. I now turn it over to Lawrence Hazley.
Great. Thank you, Taina. Good morning, everyone. It's truly been an honor to document this work and all that it catalyzed. And there simply is no way to do it justice in the short form. So please visit www.interfaithcasestudy.org for all the details, videos, and illustrated time and more. We began in 2012 with the bankruptcy of Interfaith Medical Center that galvanized the efforts to save it. Interfaith's bankruptcy was caused in large part by inadequate Medicaid reimbursement rates, but the situation was compounded by decades of what the Daily News described as a $16 million white-collar feeding frenzy in a cash-strapped hospital struggling to serve some of the poorest neighborhoods in the city. At stake were 1,544 jobs, greater risk to those who would have to travel further for emergency care, a much-used behavioral health department, and the loss of an anchor institution for the local economy, to mention the most obvious. Interfaith staff and union organizers from 1199 SEIU and New York State Nurses Association, or NYSNA, began meeting in the cafeteria to strategize on how to keep the doors open. They soon joined forces with longstanding advocates of the hospital who enlisted a range of trusted community leaders. The combined efforts became the Coalition to Save Interfaith. 19 hospitals in New York City had closed in the previous 10 years. Union leadership and workers alike knew they needed new approaches. Town halls, rallies, marches, picketing, the issuance of reports, and an all-night vigil, even a play, went on throughout 2013 and into 2014. Interfaith's fate hung in the balance as decisions by the bankruptcy courts were made, deferred, reversed, and reinstated. Interfaith employees attended the court proceedings religiously. The judge noted that she had never seen a bankruptcy with every session attended by employees in the uniforms, doctors, cleaners, nurses, environmental workers, everyone. On January 17th, 2014, Interfaith's then CEO made a call to stop accepting ambulances. Staff knew this was the first official step to closure. They occupied the hospital, beginning with escorting the CEO from the premises. In less than 2 weeks from the occupation, state funding to keep Interfaith open was soon approved. Soon after, New York State was awarded an $8 billion Medicaid waiver, part of which would be used for Interfaith. The unlikely victory in the fight to save Interfaith was also an opportunity to reinvent it. Luckily, there would be resources to get the reinvention started. As part of the Medicaid waiver, in 2014, Brooklyn hospitals were funded through a 5-year program called DISRIP to partner with each other and with community-based organizations to reduce avoidable hospitalizations by 25% through care coordination and addressing the social determinants of health. Interfaith joined the participant partnership led by Community Care Brooklyn and Maimonides Medical Center. There was also a roadmap for reinvention. 1199, NYSNA, and the Coalition commissioned MIT CoLab to prepare Caring for Today, Planning for Tomorrow, the need and potential to transform Interfaith for better community health, published in 2014. Beginning in 2016, to foster community involvement in the decisions that most affect health, the partners enlisted neighborhood youth in conducting participatory action research in 12 Brooklyn neighborhoods for 4 consecutive summers, noted as a galvanizing force for the effort. Later in 2016, Ms. LaRay Brown was named president and CEO. Ms. Brown was a leader carefully vetted by the Coalition, with a strong track record who understood the community and Interfaith's role in it. By January 2018, Interfaith, Brookdale, and Kingsbrook hospitals would come together as the one Brooklyn health system in order to improve care and reduce costs, and Ms. Brown was appointed CEO. In May 2018, many of the leaders here today traveled to Cleveland to learn more about the healthcare anchor economy efforts there. Soon after, they confirmed their own commitment to leveraging their institutional power to advance community health and wealth. In 2019, they formed Brooklyn Communities Collaborative as a nonprofit organization to carry that work forward. The goal of BCC is to leverage the economic power of anchor institutions like hospitals and universities, which spend billions of dollars annually on goods and services. To this end, BCC is launching the Brooklyn Health Enterprise Hub to prepare community members for healthcare careers and to redirect the supply chain to benefit Brooklyn neighborhoods most affected by structural racism and economic inequality. Finally, what explains the success? What allowed these partners to save a hospital, help to reinvent a health system, and spearhead structures for strengthening community health and wealth? Leaders cited trust, transparency, consistent communication, teamwork, and commitment, as well as mutual support and self-care as central to their effectiveness. And while we will hear more during the discussion, the conditions for success also include unflappable leadership, long-running relationships, political clout, innovative organizing, the involvement of youth, university partnerships, and the social determinants of health approach. Again, to learn more about the work that's being done, please visit www.interfaithcasestudy.org. Now I'll hand it back over to Taina to begin the panel discussion.
Thank you so much, Lawrence, for taking us through that timeline, and we encourage folks to take a deeper dive by checking out the case study online. But right now, we'd like to take it back to the beginning and one of the integral members that catalyzed this movement, Miss Ned. You and your colleagues led the fight to save Interfaith. The Brooklyn Worker Council is indispensable to the transformation to One Brooklyn Health and to the vision for wellness-based development in Brooklyn. The passion that is you and your colleagues and the love that you have for your patients is undeniable. And all of you have steered Interfaith through the treacherous waters of the pandemic. How has your role in these fights prepared you for this moment when so much is at stake for our communities, for our healthcare system, and for the country? And what does the pathway forward for One Brooklyn Health look like for its workforce and its communities? I pass it to Ms. Ned.
Good morning, everyone. I sincerely hope that everyone can hear me, and I thank you for this opportunity. I want to start off by saying that I'm an employee here at Interfaith Medical Center for the past 37 and a half, I believe, years. I started working directly with patient care, which was my priority and my ultimate goal, because I love quality care. Having a mother with asthma meant that I had to learn from somewhere. So getting quality care was also important. So one day I decided that I needed to do just more than being just an employee here at Interfaith Medical Center. So I inquired about being a delegate and being a leader. So I became a delegate and started to learn all the values that come with being that type of a leader. I worked diligently, and also I worked very hard to make sure that the role as a delegate at Interfaith Medical Center was maintained. And the experience was very good, because by that time I see myself as a great and a strong leader. I felt empowered, I felt that I can do it, and nothing can stop me from being successful. So as I grow as a delegate, I became stronger and stronger. And now I am part of the table with the decision making, and that made me very, very happy. So I want to answer the question regarding parts of what Lawrence's statement was about. Back in 2012, when Interfaith doors were about to be closed, it took about 7 delegates that were very powerful women who decided, I believe there was one man as well, who decided that we cannot sit and let our doors close. There must be something that we can do. So we sat and we brainstormed and we said, listen, there must be a strategy that we can do to get some attention. So we went to one of the local funeral parlors in our community, right here in Bedford-Stuyvesant, and we had a conversation, and they were very, very supportive. So the plan was that we were gonna get a hearse alongside a casket to make a grandiose statement. So we decided to meet at the foot of the Brooklyn Bridge. There we met the same 7 delegates, a host of employees, hundreds of employees. We had the community leaders, we had community members, people who live in the community who understand the vision. We had elected officials, we had clergy, we had union leaders, we had NICENR, or Nursing Association, we have the doctors, CIR, we had coalition members, a host of people joined us there. And there we decided to take that walk. So we walked and we pranced over the Brooklyn Bridge, causing such a big domino effect. This effect caused the following: a shutdown of Brooklyn New York's, New Jersey, and even parts of Connecticut because of this 45 minutes backup in traffic, where even places like the FDR and the West Highway, two of the bridges, the tunnels were backed up for 45 minutes only because of 7 strong people that works at Interfaith Medical Center who decided to make a statement. That day we had a few arrests, but we didn't mind, but we got our point made. I want to tell you, moving along from 2015 to 2016, we got life at Interfaith. We got plans and we got a gift. The life we got was getting saved from bankruptcy, getting saved from closure. The plan we got was $664 million and a merger for 3 institutions, which is Interfaith, Kingsbrook, and Brookdale. Together, we will be stronger. That was the plan. The third gift we got, and this was a phenomenal one, and that is a woman. Kisses to you, our president and CEO of Interfaith, Miss LaRay Brown. I love her. She is phenomenal. She is a great leader. She is smart, she's powerful, and she's influential. God knew why he sent her to us. And she has been doing well within the past 4 years. And I hope that she will stay with us for the next 20 years. So thank you, Ms. Brown. Recently, we have experienced a pandemic. Everybody knows about that, where the coronavirus entered into our hospital. It was something that we knew nothing about, very little information. But one thing we did was we maintained the guidelines of the CDC, which was very important to Ms. Brown and her team, which includes Dr. Prasanna Alston, our Chief Nursing Officer, alongside Dr. Stephen, who is the medical officer. That team sprung into action, came up with so many strategies how we can minimize the spread of this virus in our hospital. And so we can say today that we have lost no lives of employees in this building of Interfaith Medical Center, which I am so proud to say, under the leadership of Ms. Brown. So again, thank you, Ms. Brown. I will be amiss if I didn't mention my 1199 union, my health union that has done so much for me personally and so much for our hospital Interfaith. With the leadership of our president, Mr. George Gresham, thank you so much. Thank you for such short notice. Thank you for saying yes to this panel. And thank you for your leadership. You are a wonderful president, and the love continues. I want to also say to question number 2 that the pathway forward for One Brooklyn Health System and the workforce can either be bright or it can be gloomy. It all depends on us, the workers and leaders, as well as elected officials who are willing to bring a success. Brooklyn Worker Council is successful, and when used wisely, we can bring positive change in Brooklyn and other areas. Can you just imagine if we organize the workers in places like Brooklyn, in Bronx, in Queens, in Staten Island, in Long Island, to have a worker council like what we have just put in place? Can you imagine how powerful we would be? And even other 1199 areas. So I want to say, as a co-chair, a lot of work has to be done. We have to educate and organize the workers. If I work in a community and cannot live there because of gentrification, then I need to organize for housing. I believe also that if I live in a community and I cannot get food, then I need to organize. If I live in a community and I cannot find housing, then we need to find housing, which is something that Ms. Brown, again, I have to call her name, has opened the gateway for us to be able to speak to elected officials and all the people that are at B to help us to get housing. Thanks to Paulette Forbes, one of my co-chair at the Worker Council, who was very instrumental. Thanks to all the people. I want to say everyone. I don't want to specifically call names because if you leave out anyone, you're in trouble. So I just want to say thank you all, each and every one of you, for your input. I am greatly honored and I appreciate all that you have done. It's a lot of work to be done, like I said, but we're all in this thing together. And as they say, united, we can get it done. There was a quote from Bob Marley that says, "One love, together, we're in this together, and we will make it work." Thank you all.
Thank you so much, Ms. Ned. We appreciate having your voice and the spirit of the people with us today. So thank you again for being here. And we hope to come back to you later on with some questions, because there is a question in the chat about food systems and how we move some of these things forward. So we hope to hear from you a little bit later. Citizen Green, you were born and raised and served Brooklyn in the New York State Assembly for 26 years. You're part of the fight to keep Interfaith open from early on, and in 2014, you became one of the co-chairs of the Coalition to Save Interfaith with your colleagues. How has your role as co-chair of the Coalition to Transform Interfaith prepared you for this moment when so much is at stake for our communities, for our healthcare system, and for the country? And what does a pathway forward look like to you, especially in terms of the proposed Brooklyn Health Enterprise Hub? So I pass it over to Citizen Green.
Thank you very much. Very honored and pleased to be on this panel, and particularly most honored to be on this journey that started out with a struggle for economic and social justice. I think for me, the coalition serves as a national model at a time in which the country is struggling to see how it can unify to address a number of different issues, including the crisis in our healthcare sector that's impacting on numerous communities. And as the COVID pandemic has exposed the structural, economic, and racial inequalities that are impacting different communities across the nation. The Interfaith Coalition some years ago began a struggle that again could serve as a national model to address this crisis. First, by recognizing, as Ned just said, the importance of a community labor coalition response, that labor can't do it by itself, nor can the community organize by itself to protect and defend our healthcare institutions and to build health and wealth. So the model of a community labor coalition, again, serves as a national model. And then I recall that there was a meeting right after I became a co-chair of the coalition. I was sitting next to Sharani Perry on my left, and I think Eliza Caboni on my right, who was representing Neisner. And we were trying to get a meeting started and couldn't. And we were in the large meeting room at Interfaith, and it was just impossible to get the meeting started because the delegates and members of the community were just like fighting mad. So we had to change the agenda schedule, and we put Jeanette Harper on first. I said, okay, let's focus on what your concern is. What is going on that you're very concerned about? And I recall Harper said that she presented evidence to us that there had been a person that was hired by management to do staffing ratios and was being paid $69,000 a month, who was being flown in from California to do the staffing ratios at a time when Ned and Harper and Dina had organized through the Labor Management Committee to agree to do the staffing ratios for free. And they were so pissed off, they said, well, if this is the way folks are going to try to manage the hospital, we might as well shut this damn thing down right now. And that was a turning point. There was a point in which I recall I said, well, we need to, that sounds like a labor issue, and perhaps Bruce and Eliza Caboni can meet with the management next week to talk about how to get this resolved. And I remember them pointedly saying, oh, hell no, this is a community labor issue, and demanding that there would be representation from the community in the meeting with the management as well. And I think that was a turning point in demonstrating the importance of labor community coalition. And it was at that point, about, I think, 2 weeks later, that we changed the name of Interfaith from the Coalition to Save Interfaith to the Coalition to Transform. And as a result of that, then commissioned MIT CoLab to come out with the report that George Gresham spoke about, in which he presented that report to the governor that talked about a change in the management. Thank God LaRay Brown is here. A change in the board of directors, a change in the approach. And one of the key things that folks talked about was the importance of aligning the resources of the community, that is the resources of the institution itself, to invest in the community. We talked about for the first time the concept of the social determinants of health, which everyone's talking about today. But that was some close to 8 years ago that we started talking about the social determinants of health. What are the toxic triggers that cause poor health in different communities? So when I think about that, what I think about is how do we move forward now? Shirani Perry, 8 years ago, had begun talking about why it was important for the institution to begin to secure purchase orders from minority businesses and local businesses to ensure that a community that was impacted by structural economic inequality that caused poor health outcomes could be made more whole and more well as a result of investments from the local hospitals. And as a result of that, we're now on a journey to create what would be called the Health Enterprise Hub in Central Brooklyn that would do just that, reform the supply chain. So that's flashback. And then you flash forward, COVID-19 hits, and there was no supply chain. The hospitals were competing against each other for the PPEs, for the essential services that were needed for community, for our health care workers who were working on the front line, for the patients in our communities. And in fact, people literally died because we didn't get some of these supplies in a more efficient and equitable manner. Not necessarily at Interfaith, because Interfaith is organized quite differently, as Ned articulated, because of the leadership there, but definitely at some of the other hospitals in Central Brooklyn. And so we think that, again, this is a moment to begin to bring about, not to save Interfaith, but to transform Interfaith and to transform the rest of the healthcare sector. And I agree with Ned. Dr. King had had a quote. He says, a crisis is a two-edged sword. It's both a time of despair and a time of opportunity. And that the difference between despair and opportunity is the question of leadership. And I think in this particular case, given the great leadership of Nichelle, Ned and Harper and Dina and Bruce Richards and Maurice Reed, the leadership of our great administrator and LaRay Brown, all of the rank and filers at Interfaith, the students who've been engaged in the participatory action research projects, that for us, this moment is a time of opportunity and within this particular crisis where we could provide a national model again as we move forward to seriously address the social determinants of health and build health and wealth in our communities. So again, I'm honored to be part of the journey and look forward, to continuing in this progressive, proactive struggle.
Thank you so much, Roger, for actually giving us specific examples of the community taking fiduciary responsibility and ownership of what we want to see in our community in the fight to save interfaith and then the fight to transform interfaith, and also acknowledging all of the leaders that it took in this coalition to bring us to this moment where we are now. And one of those such leaders that you mentioned is Ms. Perry. So Ms. Perry, you were the one who, as chair of Interfaith's Community Advisory Board, brought the community leaders into the fight in a new way. You now serve as Interfaith's Director of Community Relations. What do you see as a pathway forward for continuing to strengthen the relationship between community, interfaith, and the One Brooklyn Health System?
Thank you. And just let me give a little history. The history is that the unions have been meeting there at Interfaith Hospital, and I was summoned by the late Diane Porter from the IM Foundation to come to a meeting, and I came to a meeting on a Saturday with her and then the person that served in the capacity I serve now, Juan Martinez. And after, being there for 2 Saturdays, and I realized that the elected officials in the community wasn't involved. And at the time, there was no community advisory board. So that was formed after I started going to meetings there, working with the unions and whatnot, as well as working with Diane Porter, who put a lot into helping us to save that hospital, putting the money up to do different things and whatnot. Afterwards, I brought in community residents, as well as I brought in elected officials and stuff. And I said, hey, this is our hospital. I was born in that hospital. So it's a special sentiment for me there. And just, saying to them, we need to be a part of this action. We have the unions there, but they don't have the support that they need, to back them up. So then that's how, I got involved with the coalition. And out of that involvement, we started the advisory board, which was made up of different factions from the community. We had clergy and everybody else. Under the leadership of Miss LaRay Brown, who was our CEO and at Interfaith Hospital, because of her background in community and government relations, she came with a strong understanding of how community has to be a part of everything that goes on at Interfaith. Because of my commitment to the community and to Interfaith Hospital, I knew that this has to be an ongoing thing. So what we have done is we continue with this coalition of community and elected officials and moving forward, having the community involved. We have a facility that's open to the community. Ms. Brown has opened the doors of Interfaith. Right now, they can't meet there because of COVID, but where we have sororities and fraternities that meet at Interfaith and work on projects with us. We have community organizations that meet at Interfaith. So we have like this whole village, the Brownstones, the Bedford-Stuyvesant, the Deltas, the Alpha Phi Alphas. We have a whole community of people who use Interfaith to meet there, but not only to meet there, but to work with us or work alongside us. If you come into the lobby right now, I reached out to the Deltas. I said, hey, we need some money. This was during COVID, and we need some money. You know, we need some PPE stuff. You know, we need this, we need that. And they came and presented a check to Ms. Brown for $9,000 that we have a copy of the check that's up in the lobby right now. Out of the coalition, and Ned can tell you that we've even helped some people get elected to office because, as George said earlier, that was an election year. So we had a city council race that was going on. And because we were able to pull those folks in who had desires to run for office and say, hey, if you want our support, you're going to have to give your support. So you have Robert Carnegie, who is our council member in Bedford-Stuyvesant, and you have Lori Cumble, who came on board, and they worked with us every step of the way, along with some, along with the other elected officials. And because of their support, we got out and supported them, and they represent us and represent the hospital. So we continue to move forward. Within the last 2 months, Ms. Brown has been speaking. She spoke at Community Board 3 and Community Board 8 virtually to bring updates on what's going on in the hospital and different things like that. And during COVID, from April to June, the community came together, and working with Jeffrey Wright, the actor, came together and fed the employees of the hospital from April to June, providing 600 meals a day to the employees. Not only that, we had community businesses who would come in and donate. I reached out to community businesses. I said, hey, these folks are there. They work in overtime. Dr. Austin is our VP of nursing, and she's as big as my pinky. And this lady works, and she was there every day along with Ms. Brown and Mr. Beauvais and other members of the staff. And I mean, we had some members that got sick during COVID, and no sooner as they felt maybe 30% better, they was right back on the forefront again. So the community came together. The community will continue to support that institution. And I think now people, if they didn't understand before the importance of keeping the doors of Interfaith open, because at the time, it was 2 hospitals to be closed. And that was Litch, downtown, and that was Interfaith in Central Brooklyn. And they chose to close Litch and leave Interfaith open. And the reason that Interfaith stayed open is because of the diligence, the commitment, and the fight. When Ned talked about closing down that Brooklyn Bridge, that was a sight for eyes to see. I mean, you just had to see it. It was like amazing. And I'm riding behind the hearse, and Robert Carnegie is standing on top of the back of the hearse trying to take pictures, because you never saw nothing like that. That was community. That was elected officials. That was the unions coming together. And in numbers, there's strength. And the good thing is that when we did a search for a CEO, and we did a national search for a CEO of Interfaith Hospital, and Roger and them can tell you that it wasn't no easy task. But when Miss Brown walked in there, she walked in there like, yeah, I got this. You know, y'all ain't saying nothing. I can handle this. And she came in and she kicked her shoes off, and she started like she was stomping grapes, man. She came in there and she looked us eye to, when a person could look you eye to eye, you know that they have a commitment and they know what they're doing. And she looked us eye to eye, and I said, well, I'm kind of scared of her. I ain't messing with her. And I said but that was the best thing as a coalition that we could have done, because the people who came after we came out of bankruptcy, they were robbing us. Ms. Brown came in and she set the record straight, and she did what had to be done. And you don't know everything. And my mother used to always say, no one monkey runs the show. So when we had the coalition trying to save Interfaith Hospital, I'm not a medical person, but I reached out to Maurice Reed. And then I reached out to Roger Green, who's my brother. And I reached out to different, I said, y'all got to come in, Roger. If I'm going to be working at the hospital, then you need to be in here now, because this is something that you need to take over. And anybody knows Roger, you know, he's one of the most intelligent, historical people I know is Roger, because sometimes I need a dictionary to look up the words when he be saying certain words. All jokes aside. But, you know, the community is there. The community is going to continue to be there. We are going to continue to stand strong in this community. When Ned was talking about housing and everything else, we're getting ready to build housing right across the street from the hospital, in the parking lot across the street from the hospital on Herkimer Street. And that's going to be providing housing for our people in central Brooklyn. And there's just so much going on. So my hat off to Roger and Bruce Richards and Maurice, who took up the mantle, and they went all the way. They went and found Phil Thompson and your organization and everything. And they just took this to a whole nother level. And for this, I'm thankful as a community person, and I'm also thankful as an employee of Interfaith Medical Center. And we have people now coming to the hospital that never came to the hospital before. People in the community. You know, we got the haves and the have-nots. So now we got the haves coming in to Interfaith Hospital and during COVID, I can't mention names because of HIPAA, during COVID, came to the hospital and to today, still talking about the treatment that they got, still talking about how they were treated and the medical professionalism and everything else. And these are part of the haves, not the have-nots.
Ms. Perry, thank you so much for that, and really speaking to power organizing, right? Some people look over organizing and they think it's a tool of the past, but I think the story that you just told us has actually confirmed that this is a story of the people coming together, pooling their own internal resources to save what was important to them. And we're going to go to Mr. Richards. You were also a part of the fight to keep Interfaith open from early on, and in 2014 became one of the co-chairs of the coalition. What does the pathway forward look like for you as someone focused on strengthening community building by labor?
Thank you, Taina. First, I wanted to just ditto with what Shirani said on the wealth of experience that's around us. I feel very fortunate and humbled by the insight and lessons from different leaders over this period. The woman leaders at Interfaith, the leadership of the union at Brookdale, the Interfaith Coalition, Maurice Reed, and in particular, hospital CEOs like LaRay Brown and previously Pam Breyer from Maimonides, who, though they were faced with the enormous effort and difficulty of running a health system, they never compromised the integrity of important values. And I'm proud to be on a panel where every single person I have learned so much from, so I'm very appreciative of that. Regarding how my role prepared me for this moment when so much is at stake in our communities, for our healthcare system and our country, there's a watershed issue here and on this matter. And as a person that spent a big portion of my life within the union movement, it wasn't until the coalition building effort to keep hospitals open that I saw an important correlation between where people work and where they live. It's where the people that are most needed to make things work are sufficiently empowered to participate in determining what works and what doesn't. Workplaces and communities have to go through change, democratizing, improving the quality of life in both places. I realized it's unlikely that this evolution can create very broad, high levels of labor management in institutions without a high-level sense of community among neighbors and residents, seeing each other as important to improving the quality of life. This evolution of socio-economic relations regarding where people work and where they live must complement and build off each other. And I believe we are deeply involved in the mechanics of this transformation. Regarding what does a pathway forward look like for me as someone focused on strengthening community and labor by building relationships between residents and between residents and labor. 1199 in Brooklyn alone has over 80,000 members. I have come to think about this as the creation of a highly developed civic infrastructure, which is necessary to confront these major quality of life issues, where in Brooklyn, thousands of people die disproportionately annually from premature and preventable death. I believe we have to prioritize the quality of relationship building aspect in all of our work. And we've begun the process of engagement with stakeholders, and in particular unions, community-based organizations, businesses, healthcare providers, university and education, clergy. And we've been looking at critical issues and coming up with programs around them, having to deal with employment, health and housing, food and fitness, formerly incarcerated, addressing racial inequity, pulling together councils. We've been pulling together coalition, work groups, and committees. And it's important to note that we're in the process of answering an important question having to do with what a highly proactive engagement looks like regarding a recovery strategy. It's a recovery strategy now because of the pandemic, and later it'll be something else. But the highly proactive engagement and those lessons is where the real social maturity is calculated. And it's with this issue that we have to remain focused and vigilant. And I realize that when we get out of our silos and are working to improve the quality of life in the community, all stakeholders benefit. It's through having a shared vision, one that comes from how we've been working on participatory action research, and that's where community are the creators of their own tomorrow. It's a powerful way to influence policy and legislation, allowing critical survival programs to be wrestled loose. It's a high level of resident participation, which is vital to a highly successful recovery strategy. Also, a high level of resident participation is vital to improving every aspect regarding the quality of neighborhood and community life. Thank you.
Thank you so much, Bruce. Always a pleasure to have your voice and your perspective as a part of the conversation as one of the key leaders in this process. Ms. Brown, we have heard about your power, your vitality, your steadfast commitment, and the way you showed up and showed out for the people. You officially became involved with Interfaith and the coalition when you became president and CEO in 2016. With your appointment was very intentional. And can you share with us what you see as the pathway forward for the One Brooklyn Health System as a leader not only of patient care, but as an anchor institution in the local economy with influence over the social determinants of health? And I'm also gonna do a two-part thing and bring in a question from the audience that I hope you can shed some insight on. And this is from Reginald Sweeney. He says, good morning. If I may ask, what can we all do about the district food shortage that is a problem and the key to healthy life with the pandemic? And are there any healthy food suggestions as we deal with the pandemic? And how can we do better to protect people in the nursing home? So if you have thoughts on that as you talk about like how you became involved and what you see as the pathway forward, it will be great to hear from you. And I now pass the mic to Ms. Brown.
Thank you very much. I hope I'm off of mute. Okay, good. So before I start to respond to your question, which I'm excited to do, I want to just quote something, and from a leader that we recently lost. And I quote, "Do not get lost in a sea of despair. Be hopeful. Be optimistic. It is not the struggle of the day or a week or a month or a year. It is a struggle of a lifetime. Never, ever be afraid to make some noise. Get in good trouble and necessary trouble." And I'm sure all of you recognize those words, the good trouble of Congressmember John Lewis. And I think as a major theme of the speakers today, it was all about getting in good trouble and raising one's voice and frankly, necessary trouble. And so, Ms. Ned, you know, when folks talk about you being intimidating, and we had a conversation about that just this week, with Shirani's description of, you know, the sort of the emanation of the engagement of the community, and what can I say about Roger Green and Bruce Richards? But my point is that I feel somewhat disadvantaged of not having been part of the 2013 activity. I'm a latecomer into this good trouble and this struggle. But I do want to say that we are not out of the struggle. We have to continue to struggle. We have to continue to have our voices heard. And we need to make sure that folks listen to the voices of the coalition of community members, of our labor partners, of our elected officials, of anyone and everyone who has a voice, particularly as it relates to improving health in Central Brooklyn. So, you know, the other thing that I'm extremely lucky about is that I spent many years of my professional career working in the public hospital system here in New York City, where the mission and the values of the people who work in that, in those hospitals and health centers and nursing homes, where people worked for health and hospitals because of their commitment, not necessarily because of the money, and in spite of some of the challenges. And so when I came to Interfaith, it was like coming home. And my son, actually, I had planned to retire. And when I told my son that I was considering taking on the position at Interfaith, he says, "Mom, I thought you were going to retire, not work 18 hours a day, have fun with your friends." And I said to him, "I cannot retire and step away from a neighborhood and from people who remind me of where I grew up and the folks who I loved and what they did in making sure that there was social justice." And from my perspective, healthcare is a social justice issue. It always has been, and unfortunately, it always will be. And so the coalition, the work with the MIT CoLab, it's all been about social justice, and the light of that, the burning light of the issue of social justice has never shone so great as over these last several months. So back to your specific question though, how do I see the organization and One Brooklyn in particular, and in terms of its role as an anchor institution? We can be nothing else. Our individual hospitals, nursing homes, community centers are major employers in these neighborhoods that we serve. We have a responsibility to continue to look to how are we going to strengthen the economic health of the communities we serve. We cannot be hospitals where we accept that people will come to us, and where they come to us when they're sick. We have to be responsible for keeping and helping our neighbors, our communities to be healthy. It is a challenge. There's been decades of disinvestment in the neighborhoods that we serve, but our role has to be one of the anchor institution that is both investing in the communities and making the good trouble, making the good, having our voices heard in terms of advocacy. And advocacy not just about healthcare, because frankly, if that was all that we were going to do, we would not be being accountable to the people we serve and the people with whom we work. Ms. Ned talked about the fact that if you live in a community, or if you work in a community, but you can't not live in a community, then you got to do something about that. My friend Reg, who always asks these interesting questions when he asked about what could we do about food and the food shortage. And Reg, I would say to you that, again, as an anchor institution, the one thing that we can do is to bridge and work together with the community-based organizations, with philanthropic organizations, to address the issues of food shortage, to address the issue of food insecurity. And I'm sure my colleague Shari, when she talks about what BCC is doing, can provide a concrete example of what has been done by BCC over the last several months as it relates to food. I also would say that, and I've said this in a forum very recently, healthcare or health is not hospitals.
Right.
A hospital is not health. Health is what we do in terms of ensuring that the people who live in a community can live their best lives possible. And so the delivery of healthcare is probably about 10% of what would contribute to having people live their best lives possible. And therefore, as a steward of a hospital, I have to take the responsibility of working with many, many stakeholders around what can we do to improve the health of the community. I'm very lucky to have a board on which Maurice Reed's name is called, and Torian Esterling. They are board members of the One Brooklyn Health System. And when that board came together, they spent a lot of time talking about what should the mission of One Brooklyn Health System be. And they made an intentional decision that it's not about, that our mission should not just speak about quality healthcare. That's a given. But our mission should speak to how we as an organization must engage in partnerships to essentially recognize the diversity of the communities and what each community brings to the organization in terms of strengthening it, but also working to ensure that the factors that affect individuals and communities' health be something that we prioritize. And so we're looking for every opportunity we can to not just garner funding for One Brooklyn, but to provide opportunity to support the garnering of funding for other organizations within Central Brooklyn. And I believe it was Ned who talked about the gift of $663 million of capital funding that was awarded. We haven't gotten it all, I have to always say that, but that was awarded and committed to One Brooklyn Health System. That those dollars, capital dollars, were awarded to us to improve healthcare access, actually to create additional ambulatory care capacity, to improve the facilities and the infrastructure of the buildings of the hospitals, because given our financial challenges over decades, we've not made investments in the physical plant of these institutions. And frankly, that has been disrespectful to the people who are using our services. And so, because we want to make sure that the physical place where people get healthcare, those spaces are safe and respectful and state of the art. But also to create the sort of infrastructure of information and technology to facilitate our working within the system, but also with other partners. And so very specifically, one of the first things that I did as we were looking at how would we effectuate the aim specifically around the ambulatory care expansion was to say that we needed to use these dollars to invest in the federally qualified health centers. That we could have said, you know, we're going to build 31 ambulatory care centers, but knowing on many, many levels the issue of healthcare needing to be in the community, and knowing that there are other trusted members of that healthcare ecosystem, the federally qualified health centers being one member of that ecosystem, and knowing that we should be looking at how do we make sure that they are sustainable, that because they've had long traditions of serving Central Brooklyn, and therefore to direct at least $40 million of those funds to those health centers for them to expand and for them to make improvements and create greater access. To me, that's a perfect example of an anchor institution. It's about not just saying what you can do, but saying what can you do with a collective of partners in improving the health of a community that we are all responsible for.
Thank you so much, Ms. Brown. We really appreciate having your insights and your leadership and your continued stewardship of the financial resources and the community as a resource. I just want to take a moment to acknowledge that we are at 12 o'clock, but we have two important panelists that we are going to make sure that we hear from. So if you need to jump off, we want to leave you with a charge to make sure you go out and vote. That is one of the greatest things that we can do in this moment, is to stay active not only in the national presidential race, but also in the local political races as well. As a nonprofit organization that is nonpartisan, we won't advise who to vote for, but we do think that everyone needs to be out and exercise their right to vote. And also to check out the website for the case study, and also the materials that will follow from today's conversation that lead to more opportunities for direct action. So with that, I will pass it on to Dr. Esterling. You became involved with the Coalition to Transform Interfaith in your previous role as Assistant Commissioner, and as you were launching the Department of Health's Brownsville Neighborhood Health Action Center. Can you talk us through a little bit about what you see as the vision and the way forward from this movement now?
Certainly. Good afternoon, first and foremost. I always have to take a pregnant pause because it's always humbling to be in community and in company with such a illustrious group. I'm certainly the young kid on the block, and so I certainly defer to folks who I look up to, who I see as inspiration, who I have learned so much from, and I certainly thankful for even having a seat at the table to elevate ideas and innovation, but certainly to be a mouthpiece, to not speak for all Black folks and for every community, but certainly to elevate the concerns of our people and making sure that they're being heard. And so I certainly understand the power in which, the position in which I hold, and certainly hope that I continue to carry that forward. And I think we always have to be humbled by that moment. And I do think that we are trying to meet a moment. We are trying to respond in a way that our ancestors have done time and time again, and this will continue to be an uphill battle. But certainly thankful to know that folks on the left and the right are in the front of me are just doing amazing work. And so with that, Taina, as you mentioned, in my role as Assistant Commissioner at the Department of Health, I arrived on the scene around 2015. It was the tipping point for me in sort of moving from a clinical space more to essentially a public health space was certainly for me the Eric Garner case and everything that sort of transpired from there. As Ms. Brown mentioned, that social justice is certainly rooted in how public health, how healthcare, how health overall really needs to be provided and cared for and carried out. And that has certainly been something that the principle in which I stand on and been part of my work. And it was an opportunity to join the health department where the health commissioner at that time was loudly talking about racism as a public health issue, really talking about the need to disrupt and eliminate structural racism in institutions, and being clear that health equity had to be the way that we advance the agenda. And I know that we've been doing this work, but to have a commissioner of health explicitly stating it, and being clear, like that is the work that we have to do. I raised my hand without hesitation. And so, landing on the scene, I think the important part, even in leadership, I think that there has to be some deference in really understanding the historical context. And so being able to sit down with many of the leaders that are on the panel today, so many that are even not on, some who don't even hold any positions at all, other than being citizens within the community, but their voices are so powerful. And really being able to engage them and talk with them and listen, and hearing the concerns that they have and the issues that they've been battling, it really makes, it really pushed me to think about the role that I had as the assistant commissioner at that time, the role that I had to play to make sure that the resources that we had to bring, that we were able to bring to bear in the neighborhood, would land in a way that was being responsive to the community. So number one, it was data. How are we talking about the health concerns in a way that is not always demoralizing, that also uplifts and also shows the strength of the community? In 2015, the agency had released the community health profiles and had been re-released again in 2018. And I think it was a strong way for us to really think about how we can use numbers and data to really think about advocacy. And I think having that tool was so important, because then your engagement with your elected officials or your engagement with other leaders, community leaders, really gave you the information that you knew something was wrong. I have the proof right here. And I think that was really important, but I think it also transpired into, well, how do we use this information in a way that we can expand our workforce, to really mobilize and activate organizations and even young folks. And so truly it was an opportunity to work with the group, mobilizing young folks, getting out, collecting data, collecting stories, compiling it and analyzing it in a way that could then expand and really beyond just numbers. Like, we have more stories to connect to this data. All right, we can easily talk about high rates of diabetes and high rates of hypertension, but when you connect the dots to inadequate housing, unstable housing, or inadequate or food insecurity, and even being and somewhat in not a desert, but you understand that the lack of healthy food, right, in the neighborhood is contributing to the numbers that we're seeing. And so, really talking about not only the social determinants of health or living conditions, but how policies, decisions that are being made, and when those policies land, this is how it transpires. And these are the realities that people have to really navigate. And so I think, it was certainly data, and I think the way that our interventions about programs really then allow us to think about, how we can do that in communion with organizations, with labor leaders. And I think, the work that we did or are doing with the East Brooklyn Coalition, because it's not enough just for the government to say, we now have a building in Brownsville or in Bed-Stuy or in Bushwick. It's what are we doing with our staff? How are they meeting the moment by really coming into contact with organizations and thinking through solutions together? And I think that was what was monumental and inspiring for me, to see our staff really working in communion with organizations and coming up with those solutions. And so we talk about sort of this spectrum because, on one spectrum, you can, or government really, we show up and we just share information. And that's what we call, we're just involved. Like you hear from us and we tell you what's happening. Sorry. But on the other spectrum, what we're really striving for is shared leadership. Shared leadership means much more than just sharing information. It's really saying we all have the same information, and ultimately the solutions and decisions is coming from everyone collectively. No one person has more power at that table than someone else. And so how are we shifting power to our community members and really thinking together? And we wanted to move that from sort of this high thinking, and how do we move it to practice? And with the action centers and with the community leaders and with the labor leaders, I mean, we really saw that. We really saw everyone using this information, coming with the data that we had from the community health profiles, the data that we had from even from our young folks collecting information, the information that we knew what was happening. Just from all different sources. And I think that was really important. And I think when we can continue to provide that information, activate people in communities and really mobilize them, I think that's when we're getting more into thinking about self-reliance and self-determination. And I think that was really something that was harped upon me. Brother Bruce was always saying, like, that's where we're going. And really left really important information for me to continue to remember, even as I moved up in other positions. And so even as now the Chief Equity Officer for the Department of Health, is really thinking about those learned lessons, and still continue to be working at the neighborhood level, but really sort of thinking about this citywide. So I think we still have an uphill battle, even as we're addressing all these parallel pandemics. COVID is certainly not the only one that we're facing, because we certainly have been fighting and pushing against long-standing structural racism. We're still addressing, opioid overdose epidemics. I mean, there are things that we have to continue to push against, and certainly the narrative has to be that we need to do it with community. We need to be responsive. And even as we think about COVID-19, and we've been seeing these disparities in certain neighborhoods, and particularly in Black and Brown communities, is really understanding, what are the resources that we have to really at our disposal, and how do we really make it work in communities? What do we really need to do, working with hospitals and healthcare leaders, making sure that we're bringing community-based organizations who've been standing up mutual aid societies and activating barbershops and beauty salons. I mean, we heard the stories, but it's really bringing it to bear. Like, what can we really do? What's innovative? And so I think that this has been an amazing opportunity to sort of put a pin and say, we're moving in the right direction. But certainly, as Ms. Brown had mentioned, we still have work to do. We still got roads ahead of us, and we got to keep pressuring, and got to keep our foot in the pedal. And so I'm certainly here to continue to push it and advance this work. And I'm certainly thankful to even have a place at the table.
Thank you so much, Dr. Esterling. And also thank you for always being cognizant in bringing in some of our unsung members of the coalition, who are our young people. Several people mentioned there were participatory action research studies that were conducted by our young people that also empowered the next generation of leaders in this conversation. So this movement has not only been multi-generational, but it has been intergenerational, and we thank them for their activism as well. And so last but not least, I want to turn the conversation to Ms. Sukoff. Last year, your department at Maimonides and the leadership of the coalition created Brooklyn Communities Collaborative, or BCC, a formal 501c3 organization dedicated to addressing the social determinants of health by growing the kind of local, anchor-supported, community-owned economy that we have been discussing. Can you share with us some of the tangible outcomes from that work, and how is BCC set up to accomplish that mission? And what roles are healthcare workers and community members playing?
Sure.
And Sherry, I'm sorry. One thing, there's also a question in the chat that I wondered if if you could answer. Where can one go for blood plasma programs in the district if they want to offer blood, especially if they have been impacted by COVID and now contain antibodies? So if you know the answer to that, it would be great to have your voice on that as well. Thank you.
I see LaRay mouthing something, so I think she probably has the answer to that question. LaRay, do you want to just answer that one first?
Well, I actually was saying that perhaps Torian would know as well. I believe that folks should, I think you can contact 311 and to get in on the COVID, or go to the website for COVID-19 that New York City, and I believe that they'll be able to identify the sites where folks could go. Again, Torian, you might want to add to this, but I believe that there are opportunities within the public hospital system as well as other healthcare organizations.
Thank you so much.
Yeah. I can add that information into the chat so you can share it. Would you
That's
let me do that?
Thank you so much. Yeah.
All right. Thanks. First, thanks so much for including me in this esteemed group of people, many of whom I'm very, very lucky to call my teachers and my colleagues in this really important work. So, as has been well described by my fellow panelists, BCC brings on the very strong foundation of the incredible efforts over the last 7, 8, and more years, and of the partnerships and the trusts between the people and the organizations that are represented on this call and beyond. Central to the role of, central to BCC and its successes and future success is really the role of community voice in setting our priorities, setting the path forward, and driving the work to bring about meaningful, lasting change from the ground up. So BCC brings together many of the partners represented here: community, labor, hospitals, government, higher education, and others, to advance an anchor mission approach, which calls upon big places like hospitals and universities to look at the way they are spending their money, hiring their workforce, investing their resources to benefit the communities that they sit in. And when we, through the work that we all did together in DISRP, the Medicaid redesign effort, and we looked at ways to address the social determinants of health, it became pretty clear through PAR and other ways that it's really the structural inequalities that are driving poor health outcomes. And you could create a lot of programs to link people to services and improve access to food and improve housing and all of those things, which are unbelievably important. But if you don't address the structural issues that are causing all of those problems to be there, you're never going to get ahead of them. And the anchor mission approach really presents a framework to make some of those structural changes. So BCC's priorities are driven through all of this work that's come before us and through PAR and many conversations with many of you. And they are housing, advancing economic democracy, expanding care management, and strengthening community-based organizations that play such an important role in our communities. So I'll just talk a little bit, I know we're over time, so I'm going to talk just a little bit about each of those, just to give a flavor of what BCC is working on and will be working on going forward. On the housing front, there is currently a participatory action research project taking place that's focused entirely on housing, and it's looking at how to maximize the Vital Brooklyn investments and other investments in the borough in housing to make sure that the housing that's being developed is safe and takes into consideration the built environment. So is there access to healthy food? Is there access to exercise? Is there good ventilation? All of those things that are too often problems. Citizen Share Brooklyn is the name of our initiative that focuses on advancing an economic democracy. And what this is really looking at is how to leverage the purchasing that the anchor institutions are doing and the hiring that the anchor institutions are doing. So the hospital anchors that are in Brooklyn Communities Collaborative right now are the One Brooklyn Health System and Maimonides, and CUNY is the other one of our anchors. So we're looking right now, we're kind of diving into the procurement data in One Brooklyn Health and Maimonides and looking at where are we spending our money, where are there opportunities to localize that spend, to spend more money in Brooklyn, in the communities where we want to really invest? Where can we develop businesses that are unionized worker co-ops or that provide opportunities for wealth sharing for employees, so that we're not just talking about good paying jobs, but we're talking about opportunities to build wealth in these communities. We're also looking at workforce. These anchor institutions, hospitals, healthcare is the biggest employer in Brooklyn. Who's getting those jobs? How can we look forward at what the workforce needs are going to be of those anchor institutions and make sure that we're creating the training programs, the right pipeline development, so that we are giving opportunities for people from our own communities to fill those jobs in the future. Caring Communities is the name of our initiative that's focused on expanding care management services. And that's really about making sure that we are connecting people to the resources. So like I said, although that's not the entirety of what we need to do, that's an incredibly important part of affecting health outcomes and making sure that people have what they need. So working with the criminal justice system, working with other, with other social organizations, and making sure that those connections stay in place. Lastly, our final initiative is the Strong Communities Fund, and that's really about investing in community-based organizations, both financially and with technical support. So at the start of the pandemic, we invested $3 million of remaining district funding into the Strong Communities Fund so that we could help community-based organizations in Brooklyn respond to the COVID crisis. We've committed about $2 million of that so far to 19 community-based organizations, including to a number of emergency food programs. To answer the question earlier, I'm happy to share more information about that offline. And an important part of that is that there is a community-led review committee that reviews all the applications that come in for that grant funding and makes recommendations about who should be funded and who should not. And this is comprised of people from the communities, work in the community, and that's really the whole idea of BCC, is that this is a very community-driven initiative and effort, and continues to be that way. So I have lots more I could say. People should feel free to reach out, but BCC really would not be possible without all of the work that everyone here did before us, and it is in a really exciting step forward in continuing the work that has been going on for so many years.
Thank you so much for bringing those important and tangible outcomes from the process to the conversation. So we know we went over time, and we want to thank you so much for staying with us, because many of you are still here with us. The final thing we want to do is just close out by thanking all of our esteemed speakers and panelists. Thank you for staying in the struggle, a lot of times at cost to your own health and well-being. You continue to stay in the fight, and we are eternally grateful and will continue to stand with you as partners in this movement. This call to action to everyone watching this and to everyone my voice touches, this is about you. This is about the Brooklyn community. And I ask you in this moment, what are you committed to doing to advancing a community of wellness in your life, for your family and for your community? We will be following up with resources to let everyone know the work that was discussed today on the webinar and how folks can continue to stay involved and also get involved. And as Ms. Brown quoted, get in good trouble. So we charge all of you, stay in the game. Help hold our elected officials accountable and also our community partners accountable. There has been money promised that still needs to be paid out in order for this work to be actualized on the ground. Stay connected, stay involved, and let's continue the work that began with the Coalition to Transform Interfaith that has now branched off into so many important initiatives. And Ms. Brown, do you want to have the final word? I see you're off mute.
Well, I would also say that, as all of us on the panel spoke to, and you just mentioned it, that the importance of civic engagement is incredible. And we all have an opportunity to make change. And I just want to put one plug in here. The coalition's work informed the Governor's Vital Brooklyn initiative. and expanded it to be not just about healthcare, right? To be about housing, to be about food, to be about violence prevention. And that also concomitantly helped to inform BCC's objectives. And again, that started with that level of civic engagement of the community and the labor partners as to, a fight to keep an institution open, but it really opened up a bigger issue around the necessary work that is needed to create a community that has economic wealth, that has physical health wealth, and that really can, frankly, empowers everyone who lives within that community. And so I would say that we must emphasize the civic engagement. And as a hospital, we engaged this spring in getting people to complete the census. And unfortunately, we thought we had an extension, and then we've lost some ground there, but to continue that battle. So I cannot emphasize enough the level of civic engagement that is essential in order for us to make sure that we can move the needle on social justice.
Thank you so much. And thank you to all my esteemed colleagues behind the scenes. It takes a lot to get this webinar up off the ground. So I thank all of the partners that were available on the call today, all of the people behind the scene who helped to make this possible, and the work continues. Thank you so much, and have a good day, everyone.
Thank you.
Thank you.